Sleepyhead. Poor sleepy baby.
Many women experience sore nipples at one time or another while breastfeeding. Women with light skin or blonde or red hair are slightly more susceptible to soreness. Severe soreness can lead to cracked nipples, which are characterized by a sharp shooting pain when the baby latches on.
Oh, there we go.
Engorgement is another common breastfeeding problem. When you first begin to produce milk, or if you skip a feeding, your breasts may become firm, sensitive, and swollen. With frequent feedings, engorgement usually goes away within 24 hours.
Come on.
Two less common and more serious breastfeeding problems are clogged ducts and mastitis. A clogged duct results in a warm, red, painful lump in the breast. The blockage can lead to an infection known as mastitis. A sure sign of infection is a fever accompanied by an overall achy feeling. The redness, swelling, and the lump will also remain. Mastitis requires medical treatment. Your doctor may prescribe an antibiotic and recommend a lot of bed rest, nutritious food, and 8 to 12 glasses of fluid a day. To help avoid these breastfeeding problems, follow a few simple steps. Hold your baby close when you nurse and make sure she latches onto your breast with most of the areola in her mouth. Nurse from both sides at each feeding, and remember to start a feeding with the same breast you finished on last time. When you first start nursing, increase the length of feedings gradually. Vary the positions you use for breastfeeding to help reduce stress on any one part of your nipple. Break suction with your finger when removing your baby from your breast.
Good boy.
Expose your nipples to the air, ideally for 15 minutes a day. Before or after a bath is a good time. If your nipples do become sore, continue nursing from both sides, and try nursing more often for shorter amounts of time. That way your baby will be less hungry at each feeding and may suck more gently. To prevent engorgement, don't skip a feeding. If for some reason your baby sleeps through her usual feeding time, hand express or pump some milk. If your breasts do become engorged, try applying a warm washcloth to your breasts before feeding. And hand express a little milk so that your baby can latch on more easily.